Doctors, what's the most stupid thing a patient has said trying to correct you? Story 1. Woman with breast cancer. She was in the medical field too, so I'm unsure why she said the things she did. Perhaps she was still in denial? I don't know. Anyway, I was the intern when she came in for a chest tube insertion to drain her pleural effusion. It was obviously suspected to be malignant. After the procedure, I went home and the resident on call had to deal with multiple calls from the distraught staff in her ward, for reasons I shall explain below. The next morning was told by said resident, sporting a haggard appearance and bloodshot eyes from a busy shift, that she was my problem now. With that, the poor man left for home. I go in to see her and first get accosted by ward staff, who tell me she legit refused all pain meds right after the procedure, which entailed a tube scratching against her parietal pleura. Ow. So I go in and am told by this woman who, let me remind you, was employed in the healthcare sector, that the tube has been pushed in far too much and is stabbing her, and that I need to undo the stitch and pull it out a few centimeters. No lady, I'm not authorized to do that. The x-ray was fine. No intervention was necessary. I tell her she needs to take her meds if she wants the pain to get better. And she says, no joke, that pain meds will further spread the cancer and that I should know that being a student of medicine. And she further said, look, no need to tell anybody. You're a doctor. Use your own judgment and pull the tube out. Ugh. She was adamant. My professor was going to be late that day, and I obviously wasn't going to do anything without his permission. I documented her refusal and went on my way. She left by the afternoon, against medical advice. I feel bad for her, but she wants me to help, so yeah. I don't know. Was this woman really in the medical field? Or was she merely just saying that because she read a few medical blogs and was trying to get her way? Well, the guy did one thing she said to do. Use your own judgment. I think he was wise to document it and wait for a more experienced opinion. Story 2. I had a patient once with family members who were some of the most frustrating people I've ever dealt with. The patient was morbidly obese and had open sores and wounds in all her skin folds. Cleaning her when she was first admitted was like some sort of disgusting clown car. We found a floral pillowcase shoved under one fold and what we think was a smashed bread crust in a fold near her groin. Anyway, because of her weight, she wasn't a candidate for surgery and therefore there was nothing our team could do for her. I think about 5 or 6 different meetings were held with her family to discuss her prognosis. Her daughter told the attending physician that he didn't know what he was talking about and that she had been this sick before and pulled through. Her pH was so low it just read less than 6.8, and her blood pressure was a solid 60/25, despite every vasopressor under the sun running at 3 times the max doses. When the charge nurse pointed out her blood pressure on the monitor, the daughter said, I've seen lower. When she finally died, her family was livid that we didn't save her. We coded her for 20 minutes, and they told us we should have continued for at least an hour. I felt terrible that her last days were spent in such torture, all because her family was in such denial about her condition. That's sad. I can't imagine that kind of denial for a living person. I'm actually surprised this person survived several times in the past. The family probably still won't accept their responsibility in the patient's passing. Story 3. A mother brought her 14-year-old daughter to the ER due to hypogastric pain and spotting. We asked the daughter about her last period. She said 2 months ago. We asked her about her sexual history, thinking this might be an ectopic pregnancy. The mother kept butting in, saying that she's still a virgin and she has no boyfriend. We left it at that until her mother went out to go to the bathroom. The patient admitted that she had sexual intercourse with a classmate of hers. We requested a pregnancy test and HCG titers. It really looks like an ectopic pregnancy. We advised the mother that her daughter needs immediate surgical intervention. She refused to believe us, saying that the lab results are unreliable and untrue. She keeps on saying that her daughter is a virgin. She stormed out of the ER with her daughter that looked really in pain. A lot of these answers were stupid. This is one of the first that made me really sad. That poor girl. I just don't know what to say about this one. Did the daughter ever tell the mom herself? That's the only way the mom would probably accept the truth, but I do understand how hard it would be to admit that, considering the mom's reaction to her daughter being even remotely active. Story 4. Ophthalmologist here. Told the patient he needed reading glasses, which he didn't believe. I explained that everyone develops presbyopia eventually. Come on, George Clooney doesn't wear reading glasses. A, yes he does, and B, not sure why you're comparing yourself with him. Oh no. 25 years ago, I had a heck of a time as a kid because I had myopia at age 7. Family didn't allow me to wear glasses unless I'm outside because they believed the eyes would readjust to normal and myopia would decrease. I ended up perpetually squinting. No, my myopia never went down. I have very very high diopter myopia in adulthood now. Story 5. Me. Sir, I need to know why you stopped taking your antiretrovirals for your HIV. Him. Well, I met this witch online that... Me. Wait, did you just say witch? Him. Yeah. She sent me a bunch of herbs every month to cure my HIV, and they worked. Last time I checked, I was cured. Me. Where and what tests did you do to know you were cured? Him. I did an online test that the witch told me to. There were a lot of random questions, but in the end it said that I was free of HIV. Me. Okay, we'll need to do a blood test to confirm that. Now can you tell me which herbs you were consuming? Him. I don't know the name, but I have them right here. Points at his backpack. Me. May I take a look? Him. Sure. I opened the bag, and what I saw was nothing but grinded oregano with something that sadly died from a severe sepsis a month later with a highly resistant microorganism, just because a witch on a website said it smelled like chlorine. The patient, him, to stop taking his meds. Story 6. A memorable lady was utterly convinced that her friend got cancer because she quit smoking, not because she was a smoker. Duh. This lady had a mild goiter, and a reason for not quitting was that if she quit smoking, the lumps in my neck would turn to cancer. Could not be convinced otherwise. Then I referred her to ENT for her hoarse voice, and she was surprised how fast she was seen. I said, well, you're a smoker, so they were worried you might have throat cancer. Smoking causes throat cancer? I always needed a strong coffee after her. I had a coworker tell me my dad wouldn't have died from throat cancer if he never quit smoking. They've said a lot more ignorant junk like this, and I'm glad I don't have to work with them often. Wait, these people are saying that stopping the cancer-causing activity would cause cancer? I don't get the logic. Do they actually think smoking was keeping the cancer at bay? Where would anyone get an idea like that? Story 7. 1-year-old hospitalized with ingestion of an unknown pharmaceutical. No immediate signs or symptoms. Mother says it's substance H from her brother's stash. Urine comes back positive for M substance. Mom gets very angry and defensive and tells us it's just H substance, and we should stop accusing her of having M substance. Like, lady, why you think letting your toddler try H substance is so noble? I work in community mental health and see a lot of people on a wide variety of illicit substances. It always cracks me up at the number of H substance addicts that are horrified by the idea of using M substance, and M substance addicts that are offended that we would think that they would use H substance. Story 8. Med student here, but I have had 2 winners. When discussing a precancerous skin lesion on a patient, they opted to use their laser ray instead of classic treatment. It was a cancer laser ray that was bought online. It also apparently had frequencies for arthritis. They insisted that the vibratory frequency can be tuned to destroy cancer cells, just like a trained singer may be able to use her voice to break a crystal glass. The patient did not believe that cancer cells and regular cells would have the same frequency. Another patient insisted that his cancer had been properly treated at home with baking soda. He gave me a website like phkillscancer.com or something. The patient also had with them a surgery report in which it appears their baking soda consumption resulted in buildup of abnormal calcium in the walls of the stomach, which had to be removed. Story 9. When I was a medical student, this middle-aged male patient from a rural area got it in his head that I knew absolutely nothing and he was doing me a service, teaching and talking to me. He was in the colorectal clinic for something unrelated and started telling me about the gland on the back of his neck that would drain every so often. When he saw that I was unfamiliar with this particular gland, he gave me this knowing look, laughed, and started instructing me, the dumb little medical student, about this gland. Apparently, everybody has this gland for the immune system, and that his would drain when he was stressed. No, sir. I was being polite, but you have a nasty freaking abscess on the back of your neck. I was hoping that the patient would try to explain this medical wonder to my attending when he came in, but alas, he didn't. Yeah, that's always fun. The patient comes to you for help, but they want you to know that they know better than you. Well, then why come to the doctor in the first place? I think they just want to order someone around at that point. Story 10. While I am a doctor, this happened to my wife, also a doctor. Female patient came in complaining of infertility, said she and her partner had been trying to conceive for like 5 years and had tried everything. At one point, she let the pronoun slip, she and I. And my wife said, wait, let's back up a minute. Turns out the woman had been in a hetero relationship for a few years and never got pregnant despite using no protection. She then entered a same-sex relationship and again never got pregnant even though she really wanted to, leading her to believe she was infertile. When my wife tried to explain that conception requires sperm sourced from a male as well as an egg, the patient was incredulous and exclaimed that she didn't need a man in my life and she didn't like being judged. Perhaps, needless to say, the patient was lost to follow-up. Even worse is that unless this woman was trying to secretly get pregnant, then two women were dumb enough to think they could get pregnant without sperm. Story 11. When I was about 16, I went to the hospital with sharp pain in the lower right-hand side of my abdomen. It seemed pretty serious, so both of my parents were with me, which was unusual because they're divorced. A doctor looked at my symptoms and said it looked like appendicitis. I groaned, "I don't have an appendix. It was taken out." My parents said, "Yes, you do." When I was 6, I had surgery to correct testicular torsion. I kept both my testicles. My parents politely told people I had my appendix taken out to explain why I was in the hospital. I accepted this as the actual reason for my surgery. So years later, when I learned the location of the appendix, I assumed they did some kind of laparoscopic surgery through my scrotum to explain the scar there. I was very surprised to learn that I do in fact have an appendix. The pain turned out to be from a sharp piece of chicken bone. Story 12. Veterinarian here. The anti-vax movement has been slowly seeping into my profession for years, but in my area, it's gotten much worse recently. Almost every day now, I have a client inform me of how toxic vaccines are, and that I should talk to their dog's breeder because he or she is very informed. Most of the time, I'm able to convince them that this is incorrect. However, some are still quite resistant. Vaccinating for rabies is not just a suggestion, it's the law, and my clinic has a policy that we don't let any of our healthy animals be vaccinated free. I've had a few clients walk out over this policy. I feel bad for the animals. These are the same kinds of clients that won't use flea and tick prevention on their obviously flea-infested dog, but will use lemongrass and peppermint instead. Spoiler, it doesn't work. Wow, it's bad enough that kids and other humans are affected by other people's beliefs about vaccinations. Animals, especially our pets, depend on us to take care of them too. Our pets can't speak up for themselves. It's heartbreaking to think these animals are so needlessly in pain. Story 13. Paramedic student here. Not the most stupid thing I've encountered, but the most common stupid thing. Do you have any pain anywhere else? Nah, all good. Then what do you take this specific medication for? Oh, that's for my back pain. Or, any past medical history? Nah. Ever been to a hospital? Nah. Have you had a heart attack before? Yeah, how do you know? Has a massive personal medication bag to do with cardiac meds. Story 14. Woman with this weird abdominal cramping, twitching presentation. I won't say stupid because she probably had some kind of undiagnosed dementia, but definitely the most bizarre. Ask her what she's feeling, why she's twitching her abdomen. It's like it's trying to get out. Like, what's trying to get out, ma'am? My sperm. Ma'am, you don't have sperm. Oh. For those of you curious, by the time I saw her last, official diagnosis was pseudo-seizures. She had a tendency to start twitching parts of her body whenever we would start asking whether she had twitching in those areas. Ma'am, have you had any twitching in your legs? She looks at leg. Leg starts twitching. Yeah, I have. Story 15. The time I was telling the family that the patient is going to die and her lab results, pH 6.6, lactic acid 25, are not compatible with life. And they said they were pretty sure she would wake up if I put ice in her underpants. Well, yeah, we're not going to do that. She died and they still didn't believe me she was dead. They kept trying to wake her up. People are weird about ice. I had two guys who were absolutely convinced that they could lower blood pressure by dumping ice down their shirts. Why did they think ice was going to solve everything? And I'm not a medical student, so what did those lab results indicate anyway? If I had to guess, I'd say those readings indicated a long period of neglect about something. I have a bad feeling that whatever the patient had was ridiculously preventable. Story 16. Might be late to this, but a 17-year-old girl who was pregnant came into the emergency department to get checked as she was punched in the stomach. She wanted to go out for a smoke, so I did the whole pregnancy and smoking spiel. She stopped me and told me I knew nothing as the baby would be harmed if she stopped smoking straight away. I hate when people tell professionals that they know nothing in their field, especially doctors. I mean, they have to go through so much schooling. Story 17. Lady comes in with shortness of breath. We check her troponin levels. They're elevated. Ma'am, you're having a heart attack. No, I'm not. Yes, you are. No, I'm not. Her PCP came into the ER and fired her as his patient. She signed against medical advice and left. She died the next day of a frickin' heart attack. Story 18. Probably the legions of women that seemingly don't know how long it can take for an IUD to work and want it taken out because it didn't instantly stop their periods within a month. Also, the women that come in with chlamydia but deny having had sex. Like, come on, I'm not your boyfriend. You don't need to lie to me. I'm the opposite of those women. My IUD literally immediately stopped my period and I rushed to the doctor panicked because everything online said it should stop within 6 months and I thought that meant something was wrong. As a man, I have to admit, I'm sure we have it so much easier as far as family planning. There are too many horror stories of women dealing with infections and injury, all in the name of preventing pregnancy. I hope more people get wise to all the stuff women have to go through to prevent pregnancy. I'm sure this story is just the tip of the iceberg. Story 19. I'm a doctor, but this was my nana, not a patient. She was drinking 11 cups of coffee a day, which is too much. We had an intervention while visiting for dinner, and when we told her she was addicted, she responded, No, the coffee is good for me. It helps me with my shaking. She cut down once we explained to her what substance withdrawal was. The fact that you got a little old Italian lady to change her mind and do what you told her to do is amazing. Story 20. Mom of baby. I don't vaccinate. It's against my religion. Me. Oh, really? Just out of curiosity, what religion is that? Mom. I'm Catholic. Not really a correction per se, but made me laugh a lot. My mom didn't vaccinate me, and she claimed religious exemption every year because my school required it. Her religion is, like, spiritual. Story 21. Doctor here. One we commonly use is, I know my body. Scoped a guy with knee pain. The joint looked perfect. Told him after the surgery, and he told us, No, my tendons are all torn. I know my body. Told the lady she was pregnant. No, I'm not. I just had a big lunch. I know my body. My body is just a casual acquaintance. Did the doctor get some pictures of the pregnancy as proof? Would she have believed the doctor? I have a feeling she would have denied it, even with solid photographic proof. She probably would have claimed the doctor was showing her some other pregnancy to try and scam her in some way. Story 22. I've had a few patients express dissatisfaction that their Botox only lasted 3 months, and they suspected that I was diluting the Botox. Both statements are absolutely true and consistent. I can give you the full strength, but one of us is going to prison and the other into a grave. Guess which one you are. I wonder how many Botox patients don't know what it is. Story 23. Radiographer here. Had the ED doctor give me a request for soft tissue neck x-rays, and the doctor was pretty much like, don't question it, just do it. Anyway, after that patient had left the ED, doctor came and told me that the gentleman presented to ED at 3 a.m. because he had hot milk 3 days ago, and his tongue has been hurting ever since. The patient basically burnt his tongue, but was insisting on an x-ray to ensure nothing was wrong. Story 24. Had a female patient. Her mom asked me to adjust her scrotum. Trying not to burst out laughing, I said, Your daughter's scrotum? She acted like I was stupid and pointed to the back of her neck. I knew she wouldn't listen as she was so convinced, so I stopped arguing with her. And I also wanted her to go around saying it to other people. Gotta make your own entertainment. I have a feeling the mom, as a young girl, heard the word scrotum back when it was more of a taboo word and was then lied to by an adult to save face. I think that would also mean that sex education in her school district was a bit lax. I'm with the doctor. I want her to continue going around saying it. Story 25. Had a patient come into the ED for what was essentially a cold. Kept requesting antibiotics. Kept explaining that they wouldn't help her viral symptoms. But I did then sit down and give her a basic tutorial on the differences between bacteria and viruses and antibiotics and antivirals. Hopefully it was enough to help her in the medical school finals next week. Story 26. Patient comes in with abdominal pain. I think it's my gallbladder, they say. Looking over the chart, I see their gallbladder was removed 20 years ago, so that is impossible. I mention this, to which they reply, Yeah, but it grew back. Story 27. Had a patient with atrial fibrillation that needed to be on anticoagulation. I chose Pradaxa, and the patient said, No, that one does not have any antidote. In fact, it's the only new oral anticoagulant that has an approved reversal agent. Patient refused to believe me, like I got some bonus for killing her or something. Antidote? Antidote? What universe is this patient from? The Indiana Jones universe? Really? Antidote? Story 28. Patient stated he got a full fellatio at his previous hospital before being transferred to my hospital. Not sure if he was trying to say filleted in regards to debridement of his lower extremity wound. Patient satisfaction scores at that hospital are great. Story 29. Gynecologist here. Imagine a revved up version of that dreadlocked beanie-wearing woman meme. It's not vagina anymore. It's pronounced vagina now. Vagina, the warrior princess. Story 30. Me. Your blood pressure is very, very high. You need to take the blood pressure medications I prescribed you. Him. I don't need no pills, doc. All I need is Jesus. Well, to be fair, without pills, he'll get to see Jesus really soon. This one is tricky. There are too many stories where belief and science clash. I really and truly think they can coexist, and I don't think residing in one sphere should discount any exploration of the other. Story 31. I am a family practitioner, and I had a family that did not want to vaccinate their newborn because they heard that vaccines were derived from monkeys' brains, and they didn't want their child to develop monkey-like characteristics. A vaccine turned me into a newt. Story 32. I took care of a child that got chickenpox. The mother was strongly anti-vax, but was yelling at me, "How can modern medicine not have a treatment for chickenpox?" She couldn't grasp the concept that we do. She just refused it for her child. Really? What was she expecting? Even if there was another type of cure, how does she expect the cure to be delivered? By soaking in a bath of chickenpox solution? Maybe having the cure in glitter form and having a fan blow it in her face, maybe. Story 33. I introduced myself to a patient as a doctor, your anesthesiast. Patient said that I could not be a doctor as anesthesiasts aren't doctors. Not long after, another patient asked me if I had to go to uni to be an anesthesiast, and still another asked me if I had to know as much as a pharmacist. Story 34. Med student here, but a patient was telling me about how a doctor suggested she may have shingles of the eye, trying to get me to laugh at the other doctor because apparently shingles of the eye is a ridiculous concept. You can totally get shingles in your eye, though. Story 35. I asked a patient complaining of dizziness if she had ever been diagnosed with vertigo. The daughter chimed in and said, No, she's a Libra. I then laughed hysterically at her awesome joke. She was dead serious. Okay, aside from mixing vertigo with Virgo, which could be understandable, how does this person think someone would be diagnosed with an astrological sign? Does she even know how astrological signs work? Please tell me a previous doctor didn't tell them about the signs before. I really hope that isn't the case. Story 36. I didn't have a heart attack. I had a myocardial infarction. That's what a heart attack is, chiefly. Story 37. Why are you looking at my hip? I said the pain was in my knee. Please leave your story in the comments. I would love to make a video on them in the future. Also, don't forget to like and subscribe.